Carpal tunnel syndrome is a problem in which the nerves that pass from your forearm into your hand go through a connective tissue band in your wrist, and that connective band has small holes through which the blood vessels and the nerves pass. With repeated motion or use of your hand and wrist, this connective tissue gets injured and swells, and when it swells, it pinches down on those canals through which the nerves and the blood vessels go through. And carpal tunnels, when the nerves are pinched so badly that you get numbness and tingling in your fingers. And you have three different nerves. You have your radial nerve, your medial nerve, and your ulnar nerve, and one or all can be affected. The treatment for carpal tunnel is to initially use anti-inflammatory agents such as Advil, ibuprofen, aspirin if you can tolerate aspirin, to reduce the inflammation and swelling of that tissue in your wrist, to eliminate the repetitive use of the wrist that caused the swelling and injury to that connective tissue to begin with. And it's recommended that you wear what's called a cock-up wrist splint, which can be purchased at most drugstores. It's a splint that goes from the palm of the hand to the forearm and keeps the wrist straight. People who have carpal tunnel will notice numbness and tingling in their fingers when they grasp the steering wheel of the car and bend their wrist over and hold it like that, or if they ride a lot and keep the wrist bent. So the splint keeps the wrist straight to minimize pressure on those nerves as they pass through the connective tissue band at the wrist. Other things you can do is, if these non-surgical methods are not successful, is have surgery, and they actually go in and open up the little tunnel, fillet it open so that the nerve isn't being squeezed or have pressure on it from the connective tissue.